Continuing our journey to improve the success of IVF, in the previous video, we talked about how to get prepared for the IVF cycle. Regarding the IVF cycle itself, there are lots to do to get the better quality of the eggs and sperms so that we have a good grade embryos. To describe the process of IVF stimulation, we generally call the patient on day 2nd or the 2nd day of their periods. We need to do certain transvaginal scan to rule out any cyst, any excess fluid in the pelvis, or any signs of infection or any signs of cyst which can cause abnormalities in the hormone levels. We also run certain blood tests so that we know that this is the best cycle to start. Yes, if the blood tests are abnormal, we may have to cancel the cycle, give them some medication to correct the abnormality and come back next. It's not, as we know, that we are embarking on this journey not every month or every next month. So we need to start on a perfectly right foot. After the blood test, to decide the dosage of the injection, we need to see multiple parameters like the hormone values, progesterone, estrogen, FSH, thyroid values, the number of eggs which we see in the scan, that is also called as antral follicle count, weight of the patient and age of the patient. Once we start this injection, there are certain doubts which generally my patients come back with as to how many days, can you tell us how many days we're going to take? Generally it takes around 10 to 14 days to have a mature eggs. Minimum expected number of eggs to develop is around 4. If it is less than 4, we would say you're very under respond. Maybe we may have to cancel the cycle and think about coming back next cycle, or we may consider doing what is called as pooling cycle. Because if you have 4, then we may at the end up having 1 to 3 embryos, not sufficient enough. So once we decide the dosage of injection, the patients have to take injections daily. Meanwhile, we may be doing scans in between to check the response. So again, response is monitored by scan as well as blood test. We in IKEA generally monitor them by doing serial transvaginal ultrasound and measuring the size of the eggs and the blood flow around the eggs. Then comes the time where we do a ovum pickup. So how do we do ovum pickup? It's generally done under general anesthesia or a short sedation. It can also be done with a local anesthesia, but we would prefer it to be done under general anesthesia. There are no surgical cuts or incision involved in this. This procedure is done transvaginally through vagina. As we do scans transvaginally under anesthesia, we attach a needle to this vaginal probe which goes through vagina into the ovary and aspirate those eggs. So the procedure generally lasts not more than 15-20 minutes, and after the aspiration of this fluid around the follicle, in the follicle, it is given to the lab where the embryologist checks for the eggs in it. So once the embryologist check those eggs, they incubate the egg so that they fertilize those eggs with the sperms later on. Most of the time, ovum pickup doesn't require any admission. It's a daycare procedure with a maximum of 6 to 8 hours stay in the hospital. Generally doesn't lead to any kind of a bleeding, but some patient may experience, to an extent of 1 or 2%, may experience certain amount of bleeding, which may require certain injections or a little bit prolonged admission in the hospital, but rarely they would require any surgical steps to control the bleeding. Once these eggs are fertilized, they are incubated for 3 to 5 days and we freeze those egg all. In IKEA, we follow what is called as freeze all method, in sense that as we understand that this whole month they will be taking injections, they will be under stress, multiple travels, multiple injections, and hormone levels can be really on the supranormal range. The success rate of an IVF, if you do a fresh transfer, that means in the same cycle, is considered to be a little bit lower than when we do a frozen embryo transfer. So in IKEA, what we do is on the day 5, we freeze all the good embryos or blasts and later on call the patient in their next cycle to assess whether we can do the transfer. Once the embryos are frozen, they can be kept for as long as the patient wants it to be kept. So after 1 month or one cycle, we assess the patient again to see if they have any remnant cysts or how the endometrial thickness is forming. If the endometrial thickness is forming well and the blood flow is good, then we consider doing the transfer. In IKEA, we try to do only day 5, that is a blastocyst transfer. We try to keep it only for 2 embryo transfer. We do not try to do more than 2 embryos, considering that it can lead to triplets or bad pregnancy outcomes. Many a times my patients tell that, why don't you put more, we are happy to have twins or triplets. But we also need to know the outcome. Twins is not always happy ending, considering there are multiple complications which can happen, like blood pressure, diabetes, or extreme preterm birth. We need to be more careful because we intend to complete the family with at least one healthy, happy child. So in IKEA, we try to do only 2 blast transfer. Sometimes even single embryo transfer can be considered in certain situations.